Welcome back to the platform of Just Nursing Things. So today we are going to cover a very important topic that IV fluids जो कि बहुत ही important है for the aspects of competition and for your university examination because this is one of the favorite questions that are put on in the examination. So let's start with IV fluid. व्हाट आर दे? तो IV फ्लूइड लिक्विड होते हैं जो कि डायरेक्टली हम वेन में डालते हैं सो दैट अगर हाइड्रेशन स्टेटस ऑल्टर्ड हो उसको मेंटेन करने के लिए रिप्लेस करते हैं बॉडी फ्लूइड्स को, करेक्ट करते हैं इलेक्ट्रोलाइट इम्बैलेंस में बिकॉज IV फ्लूइड्स में मेनली इलेक्ट्रोलाइट्स एंड ऑल जैसे नीड्स के अकॉर्डिंग उसमें कंसनट्रेशन होती है. सो वाई आर IV फ्लूइड्स गिवन? सो टू प्रिवेंट द पेशेंट हु हैव डिहाइड्रेशन कंडीशन, who cannot drink or eat or who has severe vomiting and diarrhea in the condition of shock or bleedings during surgery and during need for drug administration. So this is the basic outlook why IV fluids are given. So now let's go focus on the main topic, that's main types of IV fluids. So let's start with crystalloids. There's very that is commonly used. So the crystalloids mainly contain water plus small dissolved salts or sugar. So in crystalloids we are having isotonic fluids. Isotonic fluids means iso means same, tonicity means the concentration. तो isotonic fluids have the same concentration as the blood. So इनका फंक्शन क्या होगा? ये स्टे करेगा इनसाइड द ब्लड वेसल. सो इट इज़ यूज्ड इन कंडीशन ऑफ डिहाइड्रेशन, in shock, in blood loss and in surgery. So examples, we are having normal saline that contains sodium and chloride and it is used in dehydration to prevent dehydration, vomiting condition, diarrhea condition and shock condition. It is compatible with blood transfusion में भी हम देते हैं normal saline को, that's isotonic fluid. And how we will remember that it's isotonic is means normal saline is isotonic. So in isotonic word we are having O. So normal saline example हो गया and we are having I. तो Ringer's lactate में I आता है तो Ringer's lactate is also an isotonic fluid. So Ringer's lactate is contains sodium, potassium, calcium, chlorine and lactate. So Ringer lactate is given in traumas condition, burn condition, surgery. So now we are having isotonic fluids, but before starting isotonic fluids let me tell that apart from crystalloids we are having colloids also. So colloids, they are thick fluid that stay inside the blood vessel. Example हो गया albumin, dextrate. This is used in severe blood loss and shock. सो अगर हम क्रिस्टलॉइड्स को समअप करते हैं तो वी आर हैविंग नॉर्मल स्लाइन, रिंगर्स लैक्टेट एंड डेक्सट्रोज. सो नॉर्मल स्लाइन मेनली किस में देते हैं? डिहाइड्रेशन, शॉक एंड वॉमिटिंग में. एंड रिंगर लैक्टेट इज गिवन इन बर्न, सर्जरी, ट्रॉमा एंड डेक्सट्रोज इज गिवन इन लो ब्लड शुगर एंड इन एनर्जी फॉर एनर्जी प्रिवेंशन. सो फर्स्ट चॉइस इन emergency condition these all are. Now let's start with we are having now hypotonic fluids. So hypertonic fluids, they have lower concentration than blood. So इसमें जो move fluid into the cell, तो इसमें fluid जो होता है वो cell के अंदर means they used to penetrate. So it is used in dehydration, hypernatremia condition. Hypotonic fluid example we are having normal saline 0.45% of normal saline, 5% dextrose in water. It is mainly used to give energy and gives energy and water. So it is not used in shock, otherwise it can worsen the hypertension condition in hypotension condition in shock. So now we are having third category, that's hypertonic fluid. So hypertonic means higher concentration than blood. So ये क्या करता है? ये ड्रेन करता है, पुल फ्लूइड आउट फ्रॉम द सेल इनटू द ब्लड. सेल से फ्लूइड को निकालता है और ब्लड में डिस्ट्रीब्यूट करता है. So hypertonic fluid is having higher concentration than blood. What is used to do? Pull fluid out of the cell into the blood. Cells say it used to take out and throw it into blood. So it is used in severe hyponatremia and cerebral edema. Example, 3% normal saline we are having hypertonic and dextrose 10%, 25%, 50%. Now we are having some special IV fluids like dextrose solution like D5W that is used in mild dehydration condition, D10 in hypoglycemia, D25 and D50 in severe hypoglycemic condition. Apart from that, we are having IV fluid with electrolyte that is used to correct deficiency like potassium chloride, sodium bicarbonate deficiency, calcium gluconate and and magnesium sulfate. So what are the routes of fluid administration? So mainly it is given through peripheral vein, hand or forearm, and central line, that's around neck, chest in ICU patient. So what are the complication of IV fluids? So IV fluids अगर ज़्यादा देंगे तो fluid overload, there will be chances electrolyte imbalance, chances pulmonary edema chances are there, infection and phlebitis chances are there. So that was all. If you found the lecture helpful, do like, share and subscribe, and we will meet up soon in part 2. So do subscribe for notification.